Good morning, team. I want to discuss a recent change in hospital policy regarding patient visitation hours. Starting next week, visiting hours will be extended to allow more flexibility for families.
That's great news, Mihira. It will be beneficial for both patients and their loved ones.
Exactly. We understand the importance of family support in the healing process. By extending visiting hours, we aim to create a more comfortable and supportive environment for our patients.
Are there any specific guidelines or restrictions for visitors?
Yes, there are a few guidelines to ensure the safety and well-being of patients. Visitors should maintain a quiet atmosphere and avoid bringing in unnecessary items. Additionally, we may need to limit the number of visitors per patient, especially during peak hours.
How will we communicate these changes to patients and their families?
We'll post notices in prominent areas of the hospital and distribute informational flyers. We'll also train our staff to answer any questions and address any concerns.
What about patients who are in isolation, Mihira?
For patients in isolation, we'll need to implement strict visitor guidelines to minimize the risk of infection. We'll communicate with their families through phone calls or video calls.
I completely understand your worry, Mihira, and it's a valid concern. I want to emphasize why these daily wound dressings are so crucial for your foot ulcer. Because this is a deep and wide wound, consistent daily dressing changes are absolutely vital. This meticulous care is essential to prevent infection, which could lead to very serious complications. More importantly, regular dressing changes promote healthy tissue growth and healing, which is critical to avoid the need for more drastic measures, such as an amputation. Regarding the dressing change itself, the process involves a few key steps. First, I'll gently remove the old dressing, ensuring not to pull too hard. Then, I'll carefully clean the wound using a saline solution to wash away any debris or bacteria. Finally, I'll apply a fresh, sterile dressing to protect the wound and support healing. Does that make sense, Mihira?